Finally, developmental aspects of the respiratory system. 4 weeks after conception, the olfactory placodes form. Those are the future nares. So if you look at the diagram that's up on the top of the slide, the holes that you see that are labeled olfactory placodes, that's what the nares will eventually become. The opening below that is the future mouth, and then those 4 little stubs are going to be arms and legs. By the 5th week, laryngotracheal buds form. So the start of the larynx and the trachea begin to form. Here you can see 5, 6, and 7 weeks of gestation, the changes that are occurring. By the 6th week, bronchi are beginning to form. And now skipping ahead to the 28th week, alveolar ducts have formed, and the infant may be able to breathe on its own if born prematurely. But it's very likely that it would need some respiratory assistance at this point. 36th to 40th week, alveoli begin forming. By birth, 1/6 of all alveoli are present. So the lungs are by no means fully formed at birth. But at 36 to 40 weeks of pregnancy, the fetal lungs are considered fully developed in terms of being ready to be born. During fetal life, the lungs are filled with fluid, and that's why we have the blood bypassing the lungs, and the gas exchange is done completely by the placenta. So we've talked about the foramen ovale, the ductus arteriosus. And then at birth, the respiratory centers are activated, the alveoli inflate for the first time, and the lungs begin to function. Postnatally, the lungs will continue to mature. More alveoli will continue to form until young adulthood. If anything interferes with lung development, that can be permanent. So for example, if smoking occurs in the early teens, that can stunt lung growth and the lungs may never fully develop, which will cause more problems down the line. In terms of breathing, infants have diaphragmatic breathing, and that's because the ribs are positioned horizontally. So the rib cage is not doing much in terms of breathing. Most of the breathing's being done by the diaphragm. And you can see that oftentimes it looks like a baby's breathing with their stomach, and that's because the diaphragm is pushing down on the abdominal organs as breathing occurs. Through development, by about age 2, the ribs have taken on a more oblique orientation, and the intercostal muscles now begin to contribute to breathing in addition to using the diaphragm. So this is comparing especially the rib cage of a newborn, 18-month, and 5-year-old. Respiratory rate is highest in newborns, and it slows until adulthood. So at its highest, an infant might be breathing 60 times per minute, and at about 12 years of age and older, that can slow to about 20 breaths per minute. Respiratory efficiency decreases as we get older. Alveoli will lose their shape and elasticity. So part of the loss of elasticity is a normal effect of aging. Air becomes trapped and it's going to be more difficult to exhale. The diaphragm becomes weaker, which means there's going to be a decreased ability to inhale and exhale, specifically when exercising. The rib cage becomes thinner and the cartilage becomes more rigid, which means there's going to be less ability to expand and contract when breathing. The nerves in the airways that trigger coughing become less sensitive to foreign particles. So particles could build up in the lungs, damage lung tissue, cause infections, and the immune system weakens, which means we become more vulnerable to infections.